So continuing cystitis and pyelonephritis. So common bugs are E. coli, staph, saprophyticus, Proteus, mirabilis. What else? Serratia, Klebsiella. So they both are same in the case of pyelonephritis. So how do we cover with? We start with Bactrim, Trimethoprim, sulfamethoxazole. Do not use in renal failure patients. Use in patients without renal failure, with no renal failure. Now next thing is we have to cover, in the case of pregnant patient, we have to focus more with the amoxicillin or ampicillin. Pregnant patient. This is I'm talking about cystitis right now. Don't confuse with the pyelonephritis. So pregnant patient, amoxicillin, ampicillin, and then we have nitrofurantoin also in the pregnant patient, nitrofurantoin, and phosphomycin. Alright, so pretty much when we talk about pyelonephritis, we have to think about, this is high yield, so think about fluoroquinolone. So we cover with ciprofloxacin. Now it's not cystitis, pyelonephritis. So infection is spread to the kidneys, and now we have to give with the fluoroquinolone, ciprofloxacin. Outpatient per oral. Outpatient per oral. Now inpatient we go with IV fluoroquinolones, or first we think about ceftriaxone IV, yes, and also IV levofloxacin, and then ampicillin, sulbactam. Okay, so inpatient ceftriaxone IV and levofloxacin, ampicillin, or sulbactam. So next thing we have is meningitis. Now we'll go with the cellulitis first. Cellulitis. What will be the common bug? We have strep pyogenes and MRSA, Staph aureus. So then we have to cover this with the same thing. This is for the treatment. TMP, sulfamethoxazole. You can cover with clindamycin, and dicloxacillin, yes. And now cephalexin, yes, cephalexin. So we'll go next is septic arthritis. What are the bugs? MRSA, yes. So Staph aureus, MRSA, and strep pyogenes. So let me show you guys. Yeah. So first thing we always do is surgical drainage. Surgical drainage, and then we give antibiotic, right? So surgical drainage, then give vancomycin. Yeah, and possibly you can also give ceftriaxone. Possibly ceftriaxone. Now then I'm gonna talk about meningitis. Meningitis, as we know from our step 1 microbiology, strep pneumonia, Neisseria, meningitis, listeria, and we have Staph aureus, immunocompromised patients. Yeah. So this is very high yield meningitis. So I make a mnemonic is CVS, like a CVS pharmacy. So think about ceftriaxone, vancomycin, and plus minus steroids to decrease the inflammation of meninges. This is ceftriaxone, vancomycin, and we have. Alright, so in order to cover listeria, elderly patient, you can add plus minus ampicillin. Plus minus ampicillin. Now the last one is I hope you can see the last catheter site infection or catheter infection or sepsis, you can say. So what are the bugs? Gram positive and gram negative. Gram positive and gram negative. And what are the antibiotic? Is vancomycin, piptazo, and of course you can also add cefepime, meropenem, coverage of gram-negative pseudomonas. So these are the most commonly, I try my best to cover most of the stuff in antibiotics, which are most common infections and their treatment when they ask in the questions. So I hope that will help you. Stay tuned.